Hi all. Today we'll discuss the proper method for examining the axillary, epitrochlear and inguinal lymph nodes, which are important in detecting local and systemic diseases. To begin with the axillary nodes, position the patient sitting comfortably with their arm relaxed. When examining the right axilla, support the patient's right arm with your right arm to keep the shoulder muscles loose. Using your left hand, gently insert your fingertips into the apex of the axilla and sweep them downward along the medial, anterior and posterior walls in turn. Follow the same steps on the opposite side. Palpate carefully for any tender, firm or enlarged nodes. Remember, the axillary region drains the upper limb, breast and thoracic wall, so enlargement can occur with infections, trauma or breast malignancy. Next, move to the epitrochlear nodes, which are located about 3 cm above the medial epicondyle of the humerus. To examine them, support the patient's wrist with your opposite hand and flex the elbow slightly. Using your thumb, palpate the groove between the biceps and triceps muscles for any palpable node. Normally, epitrochlear nodes are not felt, so their enlargement often suggests infections of the forearm or hand, or systemic conditions such as HIV. For the inguinal nodes, place the patient in a lying position. Begin by palpating the horizontal group of nodes just below the inguinal ligament, then move to the vertical group along the course of the great saphenous vein on the upper medial thigh. Infections of the leg, genitalia or perineum commonly cause tenderness in this region. Painless hard lymphadenopathy may indicate malignancy or tuberculosis. If you detect localized lymphadenopathy, always examine the drainage area for infection or tumor. For instance, submandibular nodes are tender in acute tonsillitis, while non-tender persistent enlargement raises concern for malignancy or chronic infection such as tuberculosis. Generalized lymphadenopathy involving multiple regions may suggest systemic disease like lymphoma, HIV, tuberculosis, or sarcoidosis. In such cases, extend your examination to include the liver and spleen and look for hematological signs like purpura or petechiae that indicate blood or bone marrow involvement. In summary, a thorough, systematic palpation of axillary, epitrochlear and inguinal lymph nodes, combined with attention to tenderness, consistency and distribution, provides crucial diagnostic insights into both local and systemic pathology. Thank you.